Okay, in today's webinar we will present a brief review of legal considerations when responding to the solicitation, a very brief overview of the Mass Technology Collaborative in MeHI, Massachusetts eHealth Institute, followed by a more detailed overview of the eHealth Equality Incentive Program, or eQIP. We will then review the individual components and requirements of the solicitation, including eligibility criteria, milestones, timeline, and application process. My name is Judy Iwanski. I'm the manager of the eHealth Equality Program. And also presenting with me this morning is Ross Venable, the Grant and Contract Administrator at Massachusetts Technology Collaborative. I'm now going to turn it over to Ross for a brief discussion of legal considerations.
This solicitation has been posted to the MassTech website and to Combis, the Commonwealth's procurement portal. To the extent that anything stated or presented in this webinar is inconsistent with the RFP document, the written materials will govern. MassTech reserves all right to amend, modify, or otherwise clarify this solicitation and any written answers to questions presented. Please review the solicitation carefully. It is the respondent's responsibility to check the MassTech site and also Combis for addenda or modifications to the solicitation. Please pay particular attention to submission requirements. Non-responsive applications will be rejected.
Thank you, Ross. I'm not going to spend a great deal of time on the MassTech overview. Please refer to our website if you'd like additional information. The Mass Technology Collaborative is a public economic development agency established pursuant to Mass General Laws, Chapter 40J. It is an independent authority of the Commonwealth of Massachusetts. The Massachusetts eHealth Institute, or MeHI, is a non-divisible component of MassTech and functions as one of its business divisions. MeHI is dedicated to the advancement of healthcare through the use of technology. It is the designated state agency for coordinating healthcare innovation, technology, and competitiveness, accelerating the adoption of health information technologies, promoting health IT to improve the safety, quality, and efficiency of healthcare in Massachusetts, and advancing the dissemination of electronic health record systems in all healthcare provider settings that are networked through a statewide health information exchange, the Mass Highway. This slide shows the high-level vision, mission, and goals of MeHI, including supporting the triple aim of health reform: better population health, better patient care, and lower costs of health care. At a high level, MeHI currently has 4 major initiatives: the eHealth Equality Program, the Connected Communities Program, eHealth Services and Support, and eHealth Cluster Development. This eQIP solicitation is issued as part of the eHealth Equality Program. The objective of the eHealth Equality Incentive Program, or eQIP, is to promote effective use of interoperable EHRs by eligible long-term and post-acute care provider organizations in an effort to improve the quality and efficiency of healthcare in the Commonwealth while containing costs. Note that this incentive program is for eligible organizations, not eligible providers as under the meaningful use, and eQIP payments will be made to organizational applicants. As noted previously, one of MeHI's goals is to advance dissemination of EHRs in all healthcare provider settings and facilitate their secure networking through the Massachusetts Mass Highway. Current data, including a recent MeHI provider survey, has shown that many independent, long-term, and post-acute care organizations, that is, those unaffiliated with large hospital systems, are lagging behind other healthcare sectors in the adoption of EHRs. Chapter 224 of the Act of 2012, the second major piece of health reform legislation passed in Massachusetts, directed MeHI to prioritize assistance to organizations that are generally not eligible for the Medicare and Medicaid EHR incentive program and that lack access to other resources to implement EHRs. The legislation specifically referenced skilled nursing facilities as a priority sector for funding. I will briefly review some definitions used in the solicitation. Please refer to the solicitation itself for additional detail. Long-term post-acute care services. Although MeHI recognizes that long-term and post-acute care often includes a wide array of care services and settings, including nursing homes, assisted living facilities, senior housing with services and support, home health, and hospice. To be eligible for this solicitation, an organization must have a Mass Department of Public Health Level 1 or Level 2 licensed long-term care facility or unit. Entities are affiliated if 1, their financial statements are part of the same consolidated financial statements under generally accepted accounting principles. 2, one controls the other directly or indirectly within the meaning of federal securities law. Or 3, they are under common control within the meaning of federal securities law. Patient service revenue, or PSR, is net patient service revenue, that is, gross PSR less any contractual adjustments, from third-party payers for inpatient, long-term, and post-acute care services for the last state fiscal year. That's July 1st of 2013 to June 30th of 2014. And that is for all of an organization's long-term post-acute care facility or units. Mass DPH license levels 1, 2, 3, or 4 facilities or units. Note that PSR does not include revenue from outpatient, assisted living, hospice, or other services that may be performed at those licensed facilities. The following are general requirements of any organization receiving a grant under this eQIP program. 1, you must use certified EHR technology, or CERT. They use either the 2011 edition or the 2014 edition or voluntary certification. All are acceptable. While CERT does not guarantee interoperability, certification does help ensure EHR will provide standard-based functionality that will support interoperability. Grantees must develop an approved transformation plan, must commit to achieving all 4 eQIP milestones, must complete phone interview and attestation requirements to verify attainment of milestones 2 and 3, must submit 2 midterm reports, a brief annual update due on July 1st of 2015 and another due on July 1st of 2016. Must submit a final report and attend a grantee in-person event once annually. To be eligible for participation in the incentive program, organizations must meet all of the eligibility criteria. In the next 2 slides, we will review details of each of the 4 eligibility criteria, and we'll briefly review the method of substantiation required. The first eligibility criteria is that the organization must hold a currently valid Level 1 or Level 2 license for a long-term care facility or unit granted by the Mass Department of Public Health. That license must be submitted with the application. The second criteria, the organization must not be affiliated with an acute care hospital system. A complete corporate organizational chart must be included with the application. Again, please refer to the definition of affiliated in the solicitation. Third, more than 50% of the organization's patient service revenue, as defined herein, must be public payer. That attestation is required to be documented in the PSR chart, see attachment A1B, and it is important that the appropriate supporting documentation, such as the Uniform Financial Statements and Independent Auditor's Report, or UFR, accompany the complete attachment. Please note that PSR should be calculated for all of an organization's long-term post-acute care facilities or units in the state. Mass DPH license level 1, 2, 3, or 4. However, PSR should not include revenue from outpatient or other services that may be performed at those licensed facilities. The fourth criteria is that the organization may not be an eligible hospital or have eligible professionals as defined by the federal Medicare and Medicaid EHR incentive program. An exception to this rule: if an organization has some eligible professionals, it may still be eligible if those eligible professionals that assign their EHR incentive program revenue to the organization total less than 30% of the organization's clinical staff. In addition, MeHI will consider other factors, including how the organization intends to use health IT in light of Massachusetts healthcare policy objectives. And then MeHI will contract with those applicants that meet the eligibility criteria, clearly describe approach feasibility, organizational ability, and capacity, and anticipated impact, and sufficiently demonstrate organizational need and commitment to implementing an interoperable EHR and transacting on the Mass Highway. We will review these a little bit later in the presentation in greater detail. In addition, MeHI is collaborating with EOHHS, that's the Executive Office of Health and Human Services in Massachusetts, to provide an optional additional funding to eQIP grantees to maximize EHR interoperability capabilities. The State Innovation Model, or STEM, Mass Highway Grant is a companion grant to eQIP. Additional funding will be granted to optimize the grantee's highway use cases and maximize EHR interoperability and to achieve interoperability across the continuum of care. In this program, eQIP Milestone 4 requires connection and use of the Mass Highway to exercise the use case in production and with at least one trading partner with which it is not affiliated or joined together contractually through a shared entity, and development of an approach to operationalizing opt-in for Mass Highway. Additional SIM funding will assist grantees to achieve greater volume of transactions on the highway and increasingly sophisticated use of the highway. This companion grant is closely aligned to eQIP, but is a separate funding program and will require a second application through EOHHS. Again, I will go into detail in further slides, but in general, the requirements for each milestone are as follows. Milestone 1, submission of a transformation plan that has been approved by MeHI, plus completion of highway use case development form. Milestone 2 requirements include a description of an organization's certified EHR technology and demonstration of foundational use of that technology. Milestone 3 is a demonstration of advanced use of CERT, plus an updated description of the grantee's technology. And Milestone 4 requirements include a copy of the organization's HIE or Mass Highway Participation Agreement, attestation from the grantee and its unaffiliated trading partner that production transactions are being sent or received for the use case described in the use case, a description of the organization's approach to operationalize opt-in patient consent as required for the Mass Highway. Grantees will be paid 25% of total incentive for each milestone achieved. As I said, Milestone 1 requires development of a transformation plan that has been approved by MeHI. The plan should describe how the organization will prepare and transform its practice to maximize the potential of its investments in health IT in order to achieve identifiable outcomes. Grantees must also complete a highway use case development form. Milestone 2 requires an organization to demonstrate foundational use of certified EHR technology. That is, to use the certified EHR technology to replace the paper chart and perform the following functions: clinical data repository, electronic nursing clinical documentation, and clinical provider order entry, or CPOE. Grantees must also provide a description of their certified EHR technology, including vendor, product, version, setting of care, extensive use, and chapel ID number. They must provide a plan to engage all clinicians who diagnose or prescribe and prepare them for the use of the certified EHR technology, and a description of the organization's policies and procedures adopted to protect electronic health information. For Milestone 3, grantees must demonstrate an advanced use of certified EHR technology, that is, use of CERT to manage patient care and perform at least 5 of the 9 functions listed. Integrate with practice operations or billing system, maintain an up-to-date list of active problems, generate and transmit prescriptions electronically, use clinical decision support, clinical electronic documentation of patient progress notes, provide patients the ability to interact online with their practice or view online their health information, perform medication management, enable electronic messaging within the institution and care team, and submit required forms electronically to state and federal agencies. Again, to meet Milestone 3, you have to perform at least 5 of these 9 functions. Milestone 4 requires grantees to connect to and use the Mass Highway or another health information exchange that is connected to the Mass Highway to exercise its use case in production with at least one trading partner with which it is not affiliated or joined together contractually or through a shared entity. Please note that this is a broader standard than the definition of affiliated for the purposes of eQIP eligibility. Use case examples include discharge planning, incorporating electronic lab results into certified EHR technology, public health reporting, care coordination with primary care. Other use case examples and development forms can be found on the MeHI website at www.mehi.masstech.org. This slide reiterates some of the requirements of the transformation plan required to meet milestone 1. Once a grantee is accepted, the transformation plan must be submitted within 90 days of execution of a grant agreement between the organization and MeHI. An organization's transformation plan is expected to be very comprehensive, demonstrating a thorough analysis and extensive level of detail. MeHI may request clarifications, modifications, and/or revisions to a transformation plan prior to any approval. This chart represents the tiered payment structure for eQIP grantees. The milestone payment amounts are tiered by size based on the total number of DPH licensed beds, that's levels 1, 2, 3, and 4, that an organization owns and operates in Massachusetts as follows. A small organization is up to 60 licensed beds. Medium organizations are between 61 and 160 licensed beds. Large organizations, 161 to 300 licensed beds. And a very large organization is greater than 300 licensed beds. Payments will be awarded through the achievement of the 4 milestones over a roughly 2-year period. Individual incentive payments, again tiered by organizational size, will range between $8,250 and $20,625 per milestone, and will not exceed a total of $82,500 to any one organization for all 4 milestones. Please note that milestones 1 to 3 must be met in sequence. However, milestone 4, the highway milestone, can be met any time after an organization has met milestone 1. Next, we will present an overview of the eQIP solicitation application process and evaluation criteria. This timeline slide repeats the important dates related to the RFP. Please note that a notice of intent to submit application is due by March 6, 2015. Complete applications are due by 3 p.m. on April 2, 2015. We anticipate that final eQIP awards will be announced in May of 2015. The next 2 slides outline the RFP application submission process. As Ross said, please be sure to follow the process exactly as it is laid out in the solicitation. Late or incomplete applications will not be accepted. MeHI has developed a checklist, also available on the MeHI website, that applicants can use as guidance when completing their application package for submission. An updated list of frequently asked questions will also be posted. Both electronic and hard copies of the applications are due by 3 p.m. on Thursday, April 2, 2015. After that filing deadline, MeHI may or may not seek additional information from an applicant prior to making its selection. MeHI will issue a notice of grant award for each application selected for funding that will stipulate the period of performance, the targeted milestones, the terms and condition of the award, and reporting requirements. The notice of intent to submit application should be submitted by March 6th. Note that submission of this notice of intent does not bind a prospective grantee to submit an application. However, it will assist MeHI in its review of the grant application. As stated in the solicitation, numerous documents must be submitted at the same time as the application. These include a proposal narrative, an 8-page limit, and we'll show more detail on this requirement in the next slide. The eligibility substantiation form includes an organizational, long-term, and post-acute care profile form and a patient service revenue chart with supporting documentation. Current use of health IT substantiation form, an officer certification form, a signed organizational approval letter stating support for the proposed project, application summary sheet form, and an authorized application signature and acceptance form. The proposal narrative is a very critical part of the application. Each of the items must be addressed. Note that each section does have a size limit, and the total narrative should not exceed 8 pages. It is especially critical that the narrative abstract capture the significant details of your organization's approach to meeting all the program objectives. This abstract will be used to orient those reviewing the proposals to each applicant and will facilitate contract scope writing. The statement of need should describe why the organization needs the funds that are becoming available through this eQIP program. The project approach should provide a synopsis of the organization's proposed approach to adopt and use health IT that's currently in use and or that needs to be procured in order to meet each proposed milestone. Each applicant is also required to estimate the total cost of the project and the timeline to reach each milestone. Health system integration. The applicant shall describe how the organization will support efforts to integrate long-term and post-acute care services with other care settings. For example, settings the patient is referred to or referred from. Examples might include coordinated treatment plans or maintaining continuity of care. In-kind resources. Applicant shall describe those resources that the organization intends to provide to supplement or support these incentive payments and their estimated value. Applicants must also designate a project manager for the entire project and describe how senior leadership will oversee this initiative. Value of investment. Applicants shall describe how receipt of these incentive payments will help achieve long-term benefits to the Commonwealth and meet the state's healthcare policy goals. Examples might include leveraging health IT and interoperable EHR systems to improve patient health, coordination of care across service providers, transitions of care, or a reduction in healthcare costs. Anticipated challenges. Applicants shall describe anticipated challenges and problems that the organization envisions may occur in meeting the milestones and ways that the organization intends to address them. Critical attachments to the application include the organizational long-term post-acute care profile, that's attachment A1A. That must include all DPH license level 1, 2, 3, or 4 facilities or units. A chart must be completed for every facility owned by an organization that is providing those levels of long-term post-acute care in Massachusetts. Organizational patient service revenue, attachment A1B, must include source and page number and location to support PSR amounts and percentages within the attached supporting documentation, such as the Uniform Financial Statement and Independent Auditor's Report, the UFR, or a similar audited report for the most recent fiscal year available. Must include a brief organization of the organization's long-term and post-acute care services, which should be broken out in supporting documentation or explained in a table. Attachment A2 is the current use of health information technology. Applicants are required to attest to the level of health IT that is currently implemented and available to care providers in the organization. This is required in order to determine an organizational health IT baseline for the program. Again, MeHI has provided an application checklist available on the MeHI website that may be used for reference when completing the application. MeHI will review each application submitted against the following criteria. Compliance. Has the applicant met each of the 4 eligibility criteria, including all attestation and substantiation requirements? Need. Has the applicant described why they need the funding and how other sources of funds or resources are insufficient to meet organizational goals? Feasibility. Has the applicant described a feasible approach for meeting the 4 eQIP milestones and for achieving a more advanced state of integration and use of health information technologies? Ability. Has the applicant demonstrated the ability to meet the guidelines and conditions as laid out in the solicitation? Capacity. Has the applicant sufficiently indicated organizational capacity to carry out their proposed approach to achieving program milestones? Commitment. Has the applicant demonstrated its commitment to meeting the intent of the grant and all 4 milestones? And impact. Has the applicant addressed how it intends to use its electronic health records and other health information technologies to support the Commonwealth's healthcare policy objectives?